Next up, talking that cannabis use is medical use, Lisa Buchanan.
Before I was a nurse, I was a young adult, pregnant for the first time, a healthy patient, but I live in Seattle, so I was at the UW Medical Center, an academic medical center. And during my birth, we went into crisis. My daughter had meconium aspiration, and she was very, very ill. So was I. And over the course of the next several days, she continued to decline. And we were offered a medical study. And it was scary. It was so scary. It was the only option we had, too. And she had to get sicker to qualify. In fact, she had to only have a 20% chance of life to qualify for this study. Overwhelming, so overwhelming. We signed. She got transferred to Portland. She went on an ECMO machine. She was on it for a week. There were several other families in the same situation. It was back in the day when the circuit was infused, and so the whole patient was pretty much heparinized. It was rough. I didn't touch my baby in my arms until she was a month old and transferred back to Washington at the University of Washington. Nurses supported me. They helped me have privacy to pump my breast milk so I could save it for her for when she was off the ventilator. When I got back to Seattle, they helped us learn to breastfeed because she didn't have a suckle, having been on the ventilator for so long. They supported me when we pulled the feeding tube out and we just started nourishing with breast milk. They taught me how to support her head with her atrophied muscles after having her vessels ligated on the right side. We were isolated to home. I really didn't leave the home other than going to medical appointments for the first year. And those reservations I'd had in the past about going to nursing just seemed so much smaller. A chemistry class, I could do this. I took care of this medically fragile child that nurses empowered me to do. And that's why I'm a nurse. And I bet you have stories like that too. Some critical thing that happened in your life that brought you here. In Western medicine, you have this choice and this choice, and maybe neither of them really fit what you need. I became a nurse in 1992. I value lifelong learning and radical inclusion. I wanted to work in an academic medical center, and I wanted to work in a place that took everyone. Everyone deserves health care. So, worked in orthopedic oncology at the University of Washington. So I was seeing your typical total joints, total shoulders, total hips, spine surgeries, but we also specialized in oncology, sarcoma, a rare cancer that affects young adults and is mostly in soft tissues, bones, and joints. Wow, such a rough chemotherapy routine, 96 hours of adriamycin and ifosfamide. Really rough, a lot of pain. I was medicating people with things like ondansetron, Reglan, Benadryl, OxyContin, oxycodone, PRN, scheduled. My patients, they had a lot on board, and it was really interesting. So this was 1996, 1997. Some of my clients were taking all their pumps and going outside. And they would come back, and they really smelled like marijuana. And I'd have to say, dude, you reek. He says, yeah, but you're going to give me chemo. And it made me think a little bit. Well, how do you feel? I feel so much better. I don't want to take all those drugs you're giving me. And then one of my clients in particular was an attorney. And he had a tumor in his spinal column, and he was a bright man. He was hooked up to this dilaudid PCA, and it didn't help him be the bright man he was. He had work to do, and he knew he had a limited lifetime. He needed to get things going. So I asked him, how are you doing this? He said, well, I smoked marijuana recreationally. I know it makes me feel good. And I know when I use it, my mind is clear and my pain is controlled. My institution looked the other way and let him do that, as long as he didn't do it in his room. I asked, where am I going to get information? I didn't even have the internet till 2003. This was in the late 1990s. He said, go to HempFest. So I did, and it's a Freedom of Information festival. It's about free speech. I met the coolest people. I bought books. I asked questions. I started to develop my tribe. And what I really noticed, it's about your intent, right? How you use cannabis is very personal. We've learned that we all have an ECS. We've learned that we know that all our DNA and life experience is different, and that we should have different expectations for how we use this. It's personalized medicine. So, worked at UW for 12 years. I decided to go into outpatient medicine. I was working with clients with head and neck cancer or lung cancer, most presented at stage 4. In 2013, after 25 years of working in oncology nursing, I left. People thought, what are you doing, Lisa? Well, you know what? I turned 50. It was time for me to support my inner child. And I really enjoyed learning at my own direction. So I took some classes, took some art classes, made sure I was getting lots of exercise and social stimulation. So what I see is people coming in the front door for health and wellness. They're not coming in saying, I want to get high. They're saying, I want to feel better. And I see that door as the door to hope. People have run out of options, and they're coming in looking for something else, something safer, something to make them feel better or different. This same store is also in a parking lot with an AA hall, and we're about a mile from a methadone clinic. I drive by that methadone clinic every morning on my way to work. I see some of those people in my store. I see people from the AA hall every day, and I feel bad that they have shame coming into my store because AA doesn't support them in their use of cannabis for sobriety. I believe that cannabis is an exit drug. One man in particular used to be drunk on the sidewalk in front of my store, and I used to say hi to him every morning. I now see him as a client. I used to see him every day, and he'd buy a joint twice a day. Now he buys a few joints a couple times a week. He's working. He's regained his driver's license, and he's sober, at least sober from alcohol. He has significant relationships. It's amazing, right? Every time I see him, I tell him how glad I am to see him. And he tells me how glad he is to see me and how happy he is with his new sober life. I think this is inspiring, and we have to allow people personal choice. We have to allow people to speak up. We can't allow information to be censored because it's unpopular. I hope you guys take what you learned to heart today and from yesterday's presentation. We are powerful. The new career you might create speaking to someone could be someone who could change the world, right? We're the most powerful profession. People trust us. We are advocates for patients and for our peers. It's very important that we address this as a research and evidence-based topic. We need to catch up to the cannabis world. I'm receiving education in my cannabis job, talking about the difference in therapeutics based upon chemovar and terpenes instead of more antiquated terms like sativa, indica, or strain. It's really more about effect, and this is the beginning of a healthcare revolution. Thank you for being part of it. I'm proud to be here with all of you today.